So we're looking at HCAHPS, we're looking at doing our own survey. And then we decided we needed to involve the employees more. So we've been talking a lot about how we can enthuse the employees presently, and that's been some of our discussions recently as well. Carol is attending the meeting. She's a great participant. And she has commented, John, if your meetings are taking an hour and we're out of here. I said, yeah, well, that's how we do it. Cut off in an hour, we're done. So, but she's been very helpful. And those meetings are attended by many of the departments of the hospital. Each department has been invited to send a representative. And for the most part, we have 8 or 10 there. Our staffer is Tanai, who's our BHIS person with the grant, and he's very good, and he knows his surveys, and he's very helpful. He's very technically competent, so that's nice to have.
So any idea when
We'll have that
some of
survey ready.
this stuff will be ready? Yeah, when will it be
We're
ready that we
looking
can
at
start getting information?
November, having it pretty much put together, and we will give it to you and review that here at the board. I think November is something that we can get to. We're working with scenarios of, okay, how long is it going to take to perfect a survey, and we want it in the 95% comfort range as far as accuracy. And so that it takes a certain number to get that out there. 98% is difficult to get to.
Amy, I want to make some comments on that. I don't think that we are going to share detailed information with the board. That's the reason that you have a board representative on that team. And so that committee is charged with working out all of the fine details.
Mhm.
And then along that note, I wanted to ask you just in general, you have board members assigned to certain committees right now. Is the board going to be asking those board members to provide monthly reports to you about those committees' work, or how are you going to keep in touch with what's going on in those committees?
That's how I envisioned it, those different
Okay.
committees having a standing agenda item to report on the progress of where they're at.
Okay.
Yeah.
And it may be a
And
board member that reports, it may be John that reports, but it,
Yeah.
It really should be your board member.
Yeah.
That's
So-
the work that they agreed to do. But I also wanted to ask you, you have the Clinical Outcomes Committee, the Customer Satisfaction Committee,
Mhm.
and there's one other, I think it's your Marketing Committee.
Yes.
I think
Carol's
that's
on the marketing committee,
I
and-
think that's having to be revamped.
And are you going to be asking for them to report back to you on a monthly basis or a quarterly basis? What do you think?
I think until we get a handle on some of these things, they probably should be on a monthly basis.
Yeah.
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 I don't think that reporting back has really started yet.
Right.
And your committee members might not know that that's one of their responsibilities.
Okay.
But I think that's how you're gonna be able to stay on top of how the one I'm really interested in is that Clinical Outcomes Committee.
Right.
And also customer satisfaction and marketing as well. Okay.
So for next month, so Gary, you're on the Clinical Outcomes Committee. I don't know if I can just say we'll have that on the agenda, we'll just have that as a standing agenda item every month for each of our committees.
There may not be anything to report, but it would still be on the agenda.
Yeah.
Well, we still need to know that there's nothing, if there isn't anything to report, we still need to know
Definitely, it's
that.
just as important to hear that not enough committee members attended to hold a meeting.
Mhm. That's information too. You on board doing that, Gary?
Sure.
For your committee?
Yeah.
And I'll let Carol know.
The last one that I attended, there wasn't any committee members attending. That comes.
That's an answer too. Thank you, Kirsten.
Might be a good idea if somebody could get out an email reminding everybody of what committees they were on, and then meeting schedules for them too, so.
Okay. I have a list. Do you? Can you do that, Mitzi? Thank you, John.
Mhm.
If there's no other questions, let's move on to new business. We've had some discussion about ER coverage. there was some information that came out of a health center site thing yesterday that further confused me as to how that coverage will and can continue. Have we heard anything officially from the health center of the arrangement?
I spoke to her a little bit today. Sounds like the hospital's gonna be responsible to cover during the day, 8 to 5, basically. As long as the hospital's not taken away from the clinic.
Right.
That's what the HRSA looks at, or the FQHC
That
looks
we're
at.
not, they're not having to cancel appointments.
We wanna
or
make
anything
sure
like
that the hospital, or the physician covering ER at the hospital, does not take away from the health center. So,
But they did also say that we can have health center employees covering the ER, subject to the comment you just
Right.
made. But when we do that, the health center will bill for that health center employee's time covering the ER. While the hospital
Right.
would bill for the
That's correct.
facility, the nurses, any other services
Yeah,
in
that's
our
true.
hospital.
That's true.
So it wasn't a matter, and I think that looked a little better to us, of being in a position where we could not have the health center employees cross the threshold, so to speak. We can use the health center employees to do this, but we have to be careful.
You know what I've noticed recently under the new leadership at the health center? It was never an issue until the new leadership took over at the health center. The providers were able to figure it out amongst themselves. And for some reason, the leadership at that health center is not listening to the providers and hearing how they're saying, we're the ones that manage all of this, this is our workload. And all of a sudden, I'm hearing complaints from the health center about how the hospital's pulling all of their providers away to the ER and they're having to cancel patients. That's a really new problem that we're dealing with, and I'm beginning to wonder.
I don't think it is a new problem.
No,
ma'am.
No,
It's not,
It's one of the things that came out of the HRSA site visit, that HRSA had a problem with the fact that that was occurring. And they were seeing it occur, and they were saying to the health center, you can't do that. You can't treat your patients that way.
it's happened with since the new clinic in St. Regis is being staffed. That's kind of when it started. They're just spread too thin. And usually Fridays around here, oh my goodness. Having one provider with a full staff of patients at the health center and trying to see, Fridays are heavy days in the ER. Yeah. So I really hope that they are able to get that figured out.
And it's gonna get worse if we get to Alberton up and running.
Yeah.
So, we had some discussion about having someone that the hospital owns, that could be primary during those day hours. Have we considered that into the budget at all?
We have not,
Can we-
that needs
can
to go
we-
into the budget.
Work maybe something into the new budget that we're
Yes, we
looking
can.
at?
Yes, we can.
And what kind of,
We're probably.
what kind of a return or,
Yeah, what the
some kind of an
return is.
analysis so we can
Okay.
make an informed decision on how because we have to cover the ER. And as a hospital, we need to take care of our own.
That's right.
And we need to make sure that we're not getting sloppy seconds, and that our patients can expect timely care.
Right.
well,
it's-
that also helps with quality.
Well, yeah,
Yes.
absolutely.
I mean, that person could be totally dedicated to quality and, yeah, I mean.
I would like to see some kind of work in the budget or some kind of return on an investment analysis so that we can before we actually make a real decision as an organization, how we're gonna do those coverages.
Yeah, I think
I'd
we
like
need
to
to look
have
at,
more
I think we need to
information.
figure out what options, how many different options are out there, and then look at
Right.
each one, what each one of them is gonna cost
I agree.
the whole organization, the clinic and the hospital, and see what the cost is gonna be between us.
Yep.
And I
Yeah.
think if we
So I'd rather
can
give
have-
money to the clinic than I would to somebody else.
It's a good way to look at it.
Can we have some kind of an analysis ready, I mean, for next month's board?
Yes, we can. Yeah, we'll-
Because this
Cliff and I'll work
isn't,
that out.
this issue, I'm afraid that if we sit on this at all, that the clinic's just gonna say, or the health center's just gonna say, you know what, it's done, we're not doing this anymore, and then we're gonna be stuck not having coverage in our ER.
I'm worried about that too, Amy,
Yeah.
because right now I'm completely dependent on the health center scheduling coverage for the emergency
Right.
department. And I'm looking for October's coverage right now to know who I need to match up as far as the most experienced nurse with the most inexperienced provider covering the ER, and that information's
And we
not
shouldn't have to
available
be
yet.
in that position, so.
And to cover the ER, we're really talking about an ER physician and hospitalist for the hospital, and then we can have them do quality work and visit all our patients during that 40-some-odd hours per week. And we could call it a number of things. We can call that person the medical director for the hospital, if you want to call it that. Not a chief of staff, but a chief medical officer. And that person can report to administration and work with administration, cover the ER, do hospitalist work, which means take care of inpatients. And that person, that doctor, would need to work well with the health center physicians as well, so that they trust each other, can see their patients during the day, report back, and then if the health center physicians want to come in and see those patients as well, they can do that. But once the trust goes way up, then they can be freed up to spend more time actually in the health center and not come across so much unless they want to round early in the morning between 7 and 8, and then after 5 or 6 o'clock when they finish their patients in the health center. So it could help both ways.
The other issue I think that we need to nail down as far as contractual arrangements with the health center is, I think Lloyd had brought this point up, is occasionally when we have these massive car accidents and we need all medical personnel, we gotta have some way to draw from the health center for emergency situations. Those
Right.
don't happen very often, but they do happen, and we need to be able to have,
Well,
be able to provide that care.
But as a small community, that normally happens very well. Not
It
very often
would.
do we have a small community with a federally qualified health center in it. We do have it here, but that's not too normal.
I
Okay.
know normally that happens, but I think that we need to cover our bases to make
You're
sure
right.
that,
You're right.
Yeah.
We
to
need
make
right
think
sure
so.
now.
that,
You're
that
right
we
on.
will be able to do
We need to
that.
add that as a codicil to the contracts.
Recently, I've definitely experienced reservations on health center employees' part to come over and help cover when we had a disaster in the hospital,
Mhm.
because they had health center patients they needed to see.
Mhm.
So it is different than when we signed the memorandum of understanding with them before the separation.
Just think we need an actual arrangement
Yes.
to be able to do that.
And collaboration with the health center becomes more and more important.
Yeah. Is there any other comments on the board, or? Okay.
Well, I'd like to, when we're talking the options, list the options that are available.
Yes.
Not one option, but a list of them.
Yes.
Good point.
Yes.
Good point. Yep.
Did we have anything other?
Yes.
New business.
At the planning meetings, you asked for an outline of marketing that we might be able to do. I have something to pass out here, and this is preliminary ideas that we've gleaned over the past number of months. You talked about some of them. And some of these ideas are not just for the hospital, but also to be done in collaboration with the health center, because we can't do all of these. They need to be involved.
John, do these represent the work that the marketing committee has compiled?
Well,
I don't think there's
no,
a real marketing.
there isn't
committee. I
one
think
right
that's
now.
non-defunct.
Um,
We need to figure that one out.
Yeah, we do, and Carol is very willing to serve on a marketing committee, and plans to. And what we're planning on doing in the hospital is creating a marketing committee just for the hospital. And she mentioned recently, I haven't been asked to come to a meeting yet, but I said, we'll get one going soon. So
Why don't
this
we-
did not come from her.
If we need a hospital marketing committee, let's create a marketing
Okay.
hospital committee.
Good.
I think maybe we need I don't know if we can do it, or we need a board resolution, or if we can do that this time, or we just have it on the agenda to do next month.
I think you can create a committee. I would think the bylaws would allow that, but I'm not sure. To create a committee and not make a decision is doable on a normal basis.
To me, it doesn't seem like it requires the board to do it. I think it requires the administrative team to recognize that there is an issue that warrants committee work. And
Yeah.
to formally launch a quality improvement project to improve our,
Or image,
whatever you
yeah.
wanna, yeah.
Yeah.
And this is
Yeah.
broken into 5 pieces, if you'll notice: engage public in image enhancement. It's recommended that we create an advisory board or council and have some opinion leaders on that council and meet with them, say, what do you think we need to do? And then get back to them and say, here's what we're doing, thanks, and what else do you think we ought to do? Something like that. Improve customer service, lots of follow-up calls there, script some of those. Customer service training for all the staff with the executive team leading the way in that. Expand the hours in the health center, that's something we can't do, but by bringing in a physician to cover the hospital, they would have more time to spend there, and this is obviously a collaboration item. Marketing messages to the community through mixed media, down through A through K. Number of these things have been talked about in the past. One was create a glass enclosed unit for Castle's grocery store to put announcements in, and change that every 2 weeks, every 3 weeks, whatever's going on at the hospital, announcing things that are happening, just put them in there and let them read them, and then take them out and exchange them. That's one way to and some of these things.
How is
would-
that different than the board they have out front?
It would be more focused. The board is so large, and some things stay there so long.
This
that
would be
I'm-
nice and neat.
Nice
Yes,
and
it'd be
neat.
nice and neat. There we go. A good way to put it.
Do we have a proposed budget for a marketing?
We do not yet. There is some budget money in the budget right now for this. I think it's around 10,000. We need to look at what it's gonna cost and come back to the board. But we do have 10,000 there. Lots of these things don't cost anything.
Right, those are the best ones.
They are, and word of mouth is the best advertising we can get going. And so, one of the first things we need to do is obviously quality, and that is communicated, it's expected, but with kindness to the patients on a constant basis. They recognize that, they recognize cleanliness, and they recognize that they're being listened to by their provider and by the nurses. They appreciate that. Lots of the medical quality that's being provided, they don't recognize because they don't know what the protocols are for quality. And we don't tell every patient, this is, the highest quality is this outcome, the lowest. We don't talk that way to patients. We just take care of them, and providers just take care of them. So they recognize kindness, being listened to, and cleanliness. And oftentimes are judged on those 3 things. And we need, and that's something that we can do and should do with every patient who comes through. So this is not a list that is comprehensive. We need to add to it. We talked about adding something to it this morning in another meeting, and Deb said, hey, we need to let the public know that if they don't have the funding and health insurance to take care of things, talk to us, we'll work with them. And so we need to communicate that loud and clear so people don't think, hey, I can't get health care because I don't have any money. We want to sit down and work with them. We want to provide health care in this community, and we need to work with the people who are here. We have 4,200. I'd like to say that all 4,200 come to this hospital first. That's not happening yet. but I think we can invite a lot more to come than we have been seeing. So read this, contact whomever, call whoever you want to at the hospital, say, hey, let's have this, I think this. Let's create a list, but we need to get going on a number of these, and we will prioritize it at the executive committee meeting hopefully soon and get going on a number of these items. Mitzi and I priced a while back a glassed-in case, and they're $1,300 to $1,800. So I'm surprised. Maybe we can have our maintenance shop build one because they are excellent. in
Where
thought-
would you put
I-
that?
So your
At Cassell's.
avenue for
At
all of
Cassell's.
your thoughts on this would be
Your marketing
Carol.
committee. Yeah.
Right.
Yeah.
So you just, if you have opinions on it,
As
share
long
it
as
with
she knows
Carol
when to
and
go,
then.
because
Right.
Yeah.
there was a point where she wasn't being invited to the meetings. and
She,
so-
we haven't had a marketing
Okay.
committee meeting that I know of for a long time. This came out of my head yesterday and last night.
Okay, well, make sure Carol knows when you guys are meeting.
And I'm sorry, and Cliff, over the past 5 months, a lot of his thoughts that he wrote
Past
out
20 years.
have gone in here. So, no, Cliff
Yeah,
has a
so
lot to do with
just make
this.
sure Carol knows.
Right.
Okay.
Okay.
Thank you. Anything for the good of the order?
Well, yes, there's a follow-up item in your packets. It looks like this. And what we've done is to put together what we decided on in the long-term planning and prioritize it as we did on the boards yesterday, Saturday and Friday. And so the quality items are here on the first page.
John, I think you might be mistaken on this. We didn't finish this in our strategic plan.
We need to run
I just
through
noticed that
executive.
the quality one does not reflect any of the changes that we made during our strategic planning meeting.
Okay, we need to perfect it then. We need to
I
go
don't-
back
The
through it.
executive
Yeah.
committee needs to review
Yeah, we
it
need to-
and go
Okay.
through it before
Go
it's
through it a
presented
little
here.
more.
Okay.
Okay, so disregard.
Well, all right. We tried, we tried to put it together, but there that is. And then this monthly reporting form is just a draft of the type of thing that I could see reporting to match this. And it's one sheet, it looks like this, it says monthly reporting form, so that you have a month to month. Here's what we've done this month, here's what we've done next month. And so you can see 6 or 7 or 8 months at once and see how it moves. So that you have a form that matches this, and that's what this is trying to be. But this does need to be perfected. The quality one is not quite what it needs to be. It's, hey, we've only had 3 days.
I understand. Okay. Is there anything for the good of the order? Well, I had my own trip to the ER this weekend,
Oh.
and I just was so impressed with the care that was given to my son and the nursing staff and how they treated him, and I wanted to say thank you, because he by the time he was, so traumatized with his broken arm and everything, but he just felt comfortable enough that he was able to even go to sleep just in the middle of the ER. It was just comforting to know as a parent that I know he was taken care of. So anyway, that's what I have for good of the order. Okay, we have an executive session for a personnel issue, so.
I'll move we go into executive session.
Second.
I think probably everybody but the board can